Good afternoon, and thank you for tuning in for our virtual town hall. I'm Lindsay Morton, the Creative Services Manager here at Lee Health. Today we're going to be answering your questions about COVID-19 and the rise of cases that we're seeing here in our community. We'll also be talking about the COVID-19 vaccine. Today I'm joined by Dr. Larry Antonucci, President and CEO of Lee Health, and Dr. Stephanie Stovall, Pediatric Infectious Disease Physician and Interim Chief in Quality and Patient Safety. Thank you both so much for being here today.
Thank you.
Thanks, Lindsay. Welcome to our Facebook Live. We're really looking forward to answering as many of your questions as we can get to today. And we continue to see unprecedented numbers of COVID patients in our hospitals. This is something that we've been watching over the past few weeks, and the numbers just continue to go up. At the present time, our hospitals are 98% full, and our ICUs are 96% full. These are our friends, our neighbors, our children, and we are very, very concerned. We are seeing patients sicker, and they're getting sicker faster. And so it's something that we think it's very important for us to be able to talk to you and answer your questions. We're also seeing increased number of children. At our Golisano Children's Hospital, our emergency department yesterday saw 265 patients. And that's more than double than what we would normally see. And of those patients, 135 had COVID symptoms. So again, this is a disease that's affecting everyone of every age, primarily unvaccinated. So we really are encouraging everyone, if you're eligible, to get a vaccine as soon as possible. Lindsay?
Thank you, Dr. Antonucci. Before we get started, I want to remind all of our viewers that all of the topics we'll be covering today have been pulled from our social media pages. We invite you, if you have additional questions, use the comment section below, send those questions in, and we'll do our very best to cover as many as we can in the hour of this Facebook Live. All right, let's go ahead and get started. So our first question that we have, what are Lee Health hospitalized COVID-19 numbers as of today?
Well, I can start that. Today we have 641 patients in the hospital with COVID, which is again an all-time high. At the highest point of our peak last year, we had 372. I think that gives you some perspective. And in mid-June, we had 30 patients with COVID. So this spike has been quite dramatic and quite rapid. Of those patients, 103 are in the intensive care unit and 84 are on ventilators. Again, both record numbers. At Golisano Children's Hospital, we have 12 patients who are in the hospital with COVID. And it's important to note that throughout this pandemic, before this surge, we rarely had more than 1 or 2 children with COVID in the hospital.
Do we know how many of the patients that are currently in our hospital, how many of them have been vaccinated?
So a few of our patients have been vaccinated, actually, and that changes day by day. We do have to manually look at that to tell who's confirmed vaccinated. But typically we have fewer than 10% of our patients who are confirmed to be vaccinated.
Why are vaccinated people still testing positive for COVID-19?
Well, it's really not all that surprising. Most vaccines are designed to prevent severe disease. They're designed to prevent death. They're not necessarily designed to prevent infection. Most viruses it's not easy to prevent infection with the virus because all of that depends upon the virus itself and it depends upon the immune system. So the vaccine keeps you from getting severe disease. It helps your immune system respond in a robust manner, but it won't necessarily prevent infection. So unfortunately, COVID falls in that category.
Do we know, are any of the vaccines FDA approved, and what does it mean to meet the full approval?
Sure. So as it stands right now, there's one vaccine in the United States that has full FDA approval as of this week. The Pfizer-BioNTech vaccine is now approved down to age 16. So 16 and above has full approval. Now, prior to this, we had 3 which were under emergency use authorization. Emergency use authorization doesn't mean untested. It doesn't mean experimental. It means that you don't have enough time for all of the data to be collected, processed, and put in a manner such that the FDA can fully approve it. So all of them have been tested. All of them have been under EUA. Pfizer-BioNTech actually is also still under FDA EUA for ages 12 up to 16, and then full approval from 16 and above.
We've been hearing a lot about the Delta variant, and of course people have questions about that. So can we kind of just explain what is the Delta variant and how is it different?
Let me just talk about mutations and variants in general terms, and then maybe you can talk about Delta. The way viruses change is by chance. Every time a virus replicates itself, there's a chance it could make a mistake when it's replicated. And so as a result, that virus will look different than the virus before that. Now, some of those changes will occur and won't have any effect on the virus. Sometimes it'll make the virus less powerful or less contagious, and other times it can make it more contagious. One of the reasons why we want people to get vaccinated and we want to slow down this pandemic is every time a virus replicates, you increase the chance that another mutation or another change can happen. And so the less viral replication, the less chance of a mutation. So what we've seen with COVID is a number of mutations that have occurred. Some of them have not been very significant, but Delta has been significant. Delta has increased its contagiousness quite significantly. And I'll ask Dr. Stovall now to comment a little bit more on about the Delta virus.
Sure. So the Delta variant, unfortunately, has a propensity to cause infection faster. It causes people to have higher, what we call viral loads. That means that they have higher numbers of viruses in their respiratory tract. The more virus you have there, the more likely you are to spread it to someone else. The rapidity with which people get infected with Delta variant means that they're getting high levels of virus really quickly before they recognize that they're sick. So unfortunately, they're spreading the virus before they even know that they have the opportunity to do so. And that's where Delta has become such a problem in our community and in the world.
Is Lee Health tracking the Delta variant?
So to track an actual variant, you have to do genetic sequencing. Genetic sequencing is not an easy test to perform. We can tell if COVID is in your respiratory tract by a variety of tests that we have here available at our hospitals within a few hours. Unfortunately, genetic sequencing requires a lot more work than that. It's primarily only done at reference laboratories, mostly state laboratories, but there are a few universities that do it as well. So we don't have the capacity, and most hospitals don't, to do genetic sequencing on viruses on patients that just come in to see us. The way that's actually tracked is usually through state health labs. They have contracts with different facilities. They get a certain number of samples periodically, and then they genetically sequence those to tell us what percentage is Delta, what percentage is a different variant. So that's where our information about Delta comes from.
Okay, thank you. So we're going to take a question from our Facebook page right now, and the question is, when do you have your vaccinated 12-year-old tested? Right now the symptoms are no fever, but showing cold symptoms.
So in our community right now, really any respiratory, GI, or fever symptoms could be COVID. We're seeing so much COVID right now that even if you're vaccinated, unfortunately, it can be a reason for you to need to be tested. Is it going to change what we're going to do? Well, that depends on how sick your child is. So would you absolutely have to go get tested in that scenario? No, but if it's going to change how you're going to act, whether or not your child is going to expose other people, whether or not there are people at risk in your household or in your close family, then that would be a reason to be tested. But cold symptoms, even without fever, can be COVID in a vaccinated individual.
Interesting, thank you.
If I might add that, and maybe Dr. Stovall, you can comment on this, you mentioned how prevalent COVID is in this community. Can you just comment on the rates per 100,000 of the U.S., Florida,
Sure.
and Lee County, so people have an idea of how common it is?
Absolutely. So in Florida right now, our rates are around 600 to 700 per 100,000. And in Lee County, we're over 800 per 100,000. So we're actually seeing more of that. If you then expand it out to the United States, it's under 300 per 100,000. So you are very likely in the state of Florida, particularly in our area right now, to have COVID as opposed to other places in the United States.
And a question that we've got too is, if a patient tests positive for COVID, how long will they keep testing positive for COVID?
So it depends on what kind of test that they have. The vast majority of tests that we do are genetic tests. So they look for the actual RNA of the virus. Those tests can be positive up to 3 months. They're going to be more likely to be positive the closer you are to infection, and then over time gradually go back to negative. So for those tests, we typically say if you don't have symptoms, we don't want you to be tested within 3 months. But if you have symptoms, you've resolved your infection, say 2 months ago, we would recommend that you go ahead and get tested, even if you're in that 3-month window, because it could tell us that you have a new infection.
And just so people understand, maybe we could go through really quickly what the symptoms are.
Sure. So you can have a variety of symptoms. Many of them start with fever. You can have body aches, respiratory symptoms such as cough, congestion, sore throat, loss of taste, loss of smell. Sometimes those don't happen until later, though. And then some people actually show up primarily with GI symptoms first. So they may have nausea, vomiting, or even diarrhea.
Thank you. Another question we just got from our Facebook page: when will we have a booster available?
So boosters are available right now for immune-compromised individuals. If you have an immune-compromising condition, or if you're on a medication that suppresses your immunity, it's recommended if you received either of the mRNA vaccines, Pfizer or Moderna, it's recommended that you get a booster. That can be done now. Eventually, it's very likely that we will have booster recommendations for other people as well. The HHS came out last week and recommended that by the end of September, we'll probably see boosters for other people. And the Advisory Committee for Immunization Practices for the FDA is going to be meeting on that soon and making a formal recommendation.
Okay, thank you. Dr. Antonucci, we've had this question. It's been discussed many times, but the question comes up again: are we requiring Lee Health employees to be vaccinated? And if not, is there a time frame on when it will be mandated for employees?
Yeah, we're currently not mandating vaccination for our staff. Our approach from the very beginning has been one of education, thoughtful conversation, and support. We feel that as healthcare professionals, all of us should be vaccinated, and we are continuing to have those ongoing conversations with our staff to encourage them strongly to get vaccinated.
Thank you. You mentioned boosters a minute ago. We just got kind of a follow-up question to that. Will there be a booster shot for the Delta variant?
So at this point, the boosters that have been discussed, the one for immune-compromised individuals and the one that will likely be coming forward for other individuals who were previously vaccinated several months ago, will be the same vaccine that you previously received. So if you received Pfizer, you'll get a third dose of Pfizer. If you received Moderna, you'll get a third dose of Moderna. There is no difference at this point for the Delta variant. There are ongoing studies right now that are looking at boosting with a completely separate vaccine, but none of those studies are available for evaluation yet.
Okay, thank you. Another question from our Facebook viewers: what are the benefits of getting the vaccine if you've already had COVID?
So that's the complexity of the immune system. So we know that natural immunity is stronger, or we know that natural immunity is not as strong as vaccine immunity. And part of that is because if you think about it, when you get a natural infection, the virus comes into your body makes an immune response to every portion of that virus that it can see. But if we give you a targeted vaccine, then your immune system can essentially pay attention to just that component. Your immune system can target what it makes the antibodies to, what it triggers the T cells from. And that targeted immune response tends to be stronger and more durable. So getting a vaccine actually improves your immunity, even if you've already had natural immunity and you've already been infected.
And hasn't that been demonstrated clinically?
Absolutely, absolutely. We definitely see that. And we see that antibody titers are higher in people who have had COVID and then they get the vaccine than in people who never had COVID and then get the vaccine even. And
to your point, can people be diagnosed with COVID more than once?
Oh, absolutely. Unfortunately, we've seen that in patients. We've seen that in loved ones and community members where people who definitely had COVID, they had positive antibody responses even before vaccines were available, and then they got COVID again. Delta, unfortunately, has kind of changed that, and it's much easier for that to happen now.
So a big question that we have, and we've discussed this many times. If you are young and healthy, do you still need to worry about getting COVID-19?
Yeah.
I definitely would. I worry about it for my kids. So my kids are in college. So they're around other young people, other students all day, every day. And unfortunately, being a pediatrician, I've seen it in our children's hospital. So some of the kids that we see with COVID have other problems. They have underlying disorders. They already have medical issues, and they get COVID. But some of these kids are completely healthy. They're normal kids. They're kids who are going to school. They're acting normally. They don't take medications. And then they wind up in our hospital, and they wind up sick. Regardless of if they recover in 2 days or 5 days, that's still a portion of their life that they wouldn't have had to spend in the hospital. It's people in their family who are exposed, who are out of work, some of whom are going to get very ill because of their underlying conditions. So unfortunately, it contributes to the public health when young people get infected, and some of those young people will be very sick.
I think something that we've learned is that this Delta variant is different than what we saw last year. Last year, you heard that the COVID virus primarily affected older folks, that younger people didn't get affected, that children didn't get infected with this virus. Or if they did, it was usually asymptomatic. We're seeing a very different clinical picture this year. We have people in our hospital in their 20s, 30s, 40s, and 50s every single day. And some of them are getting sick enough that they are dying. I mean, this is a different virus. It's getting people sicker, and it's getting people sicker faster. So we are seeing a different clinical picture, and that's why if you are young, even if you're healthy, this will still protect you. The vaccine will still protect you from serious illness and death.
Thank you. A question that we got from our Facebook page is, how do we know if someone has the Delta variant? Are we testing for that specifically?
Unfortunately, we're not. That's not an easy test for us to do. It's not one that's typically available in most hospital laboratories. We do know that over 98% of the strains that are being evaluated in our region of the country are Delta variant. So it's very likely, if you get COVID right now, that's the variant you're going to get.
There's a general rule in medicine that says don't do a test unless it's going to change how you're going to treat the patient. And whether a patient is Delta or not Delta doesn't change what we do. So it's really not critical to our treatment protocol. So frankly, it's not really important for us to do that. It's important from an epidemiologic perspective, as Dr. Stovall said, knowing that the vast majority of new cases are Delta. But it doesn't change what we do.
Okay, thank you. Another question about the boosters. Do we know anything about the J&J booster shot?
At this point, there's not any information out there yet. It's very likely that at some point we will have that information, but so far, for the immune-compromised individuals, we don't have any recommendation for boosters for those who were vaccinated with J&J. And for the upcoming recommendation from the HHS, they haven't made any statement at this point about J&J. I do expect that to happen in the future, but it's just not time yet.
Okay, thank you. What is the average time COVID-19 patients spend in the hospital?
The average length of stay that we're seeing now is about 6.5 days.
Are all patients tested for COVID-19 when they're admitted to the hospital?
No. No, we don't test you for COVID unless we think you have symptoms of COVID. With a couple of exceptions, if you're coming in for an elective procedure and we're going to put you under anesthesia, then it's good for us to know your COVID status because we need to tell you about the risk and benefit of undergoing anesthesia. But aside from that, if you're completely asymptomatic, we're not usually going to request that you're tested. Occasionally, someone will need to be tested for their work or for travel or something like that. So they may be tested by their physician for that reason. But if you come to our hospital and you're being admitted for appendicitis or diverticulitis or something like that, if we don't have a reason to test you for COVID based upon your exposure history or based upon symptoms that don't fit your clinical scenario, we don't test you for COVID.
What is the turnaround time right now for the new COVID testing sites?
So the COVID testing sites through Curative, which we have kind of partnered with them to get excess testing in our community, that's taking 2 to 3 days. Our internal testing is done within 24 hours.
We're getting a lot of questions right now, and we have some already on our list. So I'll go ahead and kind of jump to the next question, which is about the antibody treatment. Can we talk about what this is and if we're doing it here at Lee Health?
Sure, I'll start out and Stephanie, you can join in. So monoclonal antibodies are used for patients in the early stages of the disease, within the first few days of symptoms or the first few days of testing. And what it is, an infusion of antibodies that can reduce the risk of hospitalization by about 70%. So it's an effective treatment for those patients with early stage COVID. It doesn't provide long-lasting immunity. It's not like a vaccine, but it's usually used in that setting or in the setting of someone who has had close contact with someone with COVID, such as in a nursing home or something like that.
Sure, and in our facilities, there are a variety of ways to access monoclonal antibodies. So if you come into one of our emergency departments and you need to have monoclonal antibody, it may very well be administered during that visit. You may also be able to get this, like if you go to your primary care physician, they can refer you to one of our complex care centers where you can be evaluated and then receive the infusion that way. We're also, and I believe this information is on our website, sending some patients to the state-supported site, which is giving monoclonal antibodies as well. So there are a variety of ways for that to be done. The physicians can help walk you through whether or not it's appropriate for you.
Okay, thank you.
And that state site is in Bonita Springs at the old library. And I think their first day they did 300 treatments.
Wow. Thank you. How sick does someone need to be in order to be admitted to one of our hospitals?
So basically, that's a clinical decision that has to be made between the physician and the patient, and it can be different for any patient. So a patient who can't eat and drink, a patient who can't get themselves up and out of bed to the restroom, a patient who's having trouble breathing and needs oxygen support, all of those things have to go into play. Additionally, we have to consider, can you care for yourself at home, right? And so that can be different for different patients, but by and large, the things that will absolutely mean you need to be admitted are if you need significant oxygen support, or if you're unable to keep yourself hydrated while you're having a hard time breathing.
Right. We have addressed the question that you can get COVID more than once, but we're being asked how many people are actually getting COVID more than once. Are we tracking those numbers here at Lee Health?
I don't believe we're tracking it. Anecdotally, we see it, but because we're not a public health agency, we don't really track that information. The health department would probably be the best source of information for that.
Yeah.
Okay, thank you. So another question that we just got from Facebook is, how can we feel confident in getting a vaccine if we don't know the long-term consequences of the vaccine?
So I would say, we've been at this for 18 months now. And we know some of the long-term effects of COVID. We know a lot of the long-term effects of vaccines in general, and the vast majority of vaccines, when we look at those that are still in use and those that were in use for a while and then fell out of use, we know that most people who have reactions to vaccines, it happens within the first month or so. And so that's why so much study is done early on, and you don't even get the possibility of bringing one to market until you're at least 3 to 4 months out from when you started your original phase 1 and phase 2 trials. So out of the thousands and tens of thousands of patients who have received these vaccines, that gives us a lot of good information. And then historically, knowing that mRNA vaccines specifically have been evaluated for over a decade. They've been used, not specific to COVID, because that's been a new thing in the last 18 months, but mRNA vaccine technology has been out there for more than a decade and has not been associated with those long-term effects. So can we say for a specific COVID vaccine that we have 5 years of evidence? No, we can't, but we can look historically at the science behind it and predict that we don't anticipate long-term problems with these vaccines.
And I think in any therapeutic approach, you always have to look at the benefits and risks. And what we know is the risk of getting COVID is quite significant, and it's becoming more significant. And I think you just have to weigh that against the known benefit of the vaccine.
Thank you. Are we seeing a trend in a certain vaccine, and which one have we found works better?
Gosh, I don't think we haven't studied specific type of vaccine when we look at our hospitalized patients versus what vaccine they received. We obviously don't track all of the patients that we vaccinate who are healthy and don't come back to us with COVID. We have given more Pfizer and Moderna in our system than we have J&J, so we have more experience with those. And I can tell you anecdotally, in just looking at patients day by day, I don't really have a preference. So when people ask me, do I prefer one or the other, I say whichever one you can get first.
Okay.
And that's been borne out in the clinical studies too, as the vaccines have been evaluated. Their efficacies have been relatively close.
Okay. How effective is the vaccine after just one dose?
So that can be different depending on the vaccines. When you look at the actual studies, the Pfizer vaccine, vaccine efficacy, and this is pre-Delta, that's part of the problem that we have. Pre-Delta vaccine efficacy was between 50 and 60% for Pfizer, and it was between 75 and 85% for Moderna. Both of them bumped up to over 95% after the second dose. We don't know that information with Delta. We don't know if that first dose is protective for really either one of them. So full vaccination is definitely recommended.
We have a question here about when will children under 12 get the vaccine?
Hopefully soon. So the studies for the mRNA vaccines, both Moderna and Pfizer, are expected to be complete in their evaluation sometime this fall, hopefully sometime around November. But until we actually have a timeline, we can't fully answer that, but we are hopeful within the next couple of months we'll have some reprieve for those under 12s.
Okay, thank you. We're getting some questions here about pregnancy and the vaccine, so we'll go ahead and do the first question, which is, should a pregnant mother get the vaccine?
Yeah, I'll start. Both the CDC and the American College of Obstetricians and Gynecologists have recommended vaccination for pregnant women. The reason for that is the risk factors for pregnant women who get COVID are significant, both for them and their baby. And so that's the reason why it's been approved for pregnant women. Absolutely,
yes.
If a woman is pregnant and does get COVID, does her baby absorb some of the antibodies?
So that really depends upon gestational age, right? So any antibody doesn't cross until usually near the third trimester is when antibodies start to cross the placenta. So the vaccine itself will not transmit into the placenta, and so won't cross to the baby. But if mom has enough time to build antibodies, and if enough time passes for gestationally the baby to absorb those antibodies through the placenta, there can be protection. There also has been shown to be some IgG protection that crosses in breast milk. So vaccinated lactating mothers who are breastfeeding can also help their babies that way.
That was the next question about breastfeeding. There you go. And is that the same then if the mother is vaccinated, can that be transferred through the breast milk?
Yes.
Okay. So a question we have here is, do you think next week things will be worse if things don't change?
Boy, I wish I could answer that question. Every morning I wake up looking at the numbers and hoping that they're going to be better than the day before, and I haven't experienced that yet. We certainly are hoping and praying that soon we're going to reach a peak and the numbers will start falling off, but I just don't know.
Okay. We do have some questions here about masks, and I'll start with the first one. Are masks required at Lee Health?
Yes, we require personal protective equipment for everyone within the hospital and certainly for those taking care of patients.
The next question is, why is Lee Health advocating for wearing a mask in public if someone is vaccinated?
Yeah, so first of all, we've tried to follow the CDC guidance throughout the pandemic. They've been a good source of information for us at looking at the data that's out there and helping us make recommendations. So the first answer to that is the CDC recommends it. For areas where you have substantial or high transmission of the virus, like Lee County and like Fort Myers and Cape Coral, we know that vaccines aren't 100% effective at preventing infection. Remember, they prevent severe disease, hospitalization, and death. So even if we had everybody out there eligible who was vaccinated, we would still see transmission of the virus amongst those vaccinated because of our high numbers right now. Masks help prevent that. They prevent that by two ways. Me covering myself to keep me from spreading virus I don't know I have, and also a little bit for me to protect myself from virus you may spread to me. And so if everybody's doing their part by wearing a mask, we can shut down that high transmission. So we recommend it for our community for those reasons, because the science supports it and because we want to shut this down in our community and get decreased transmission.
Kids are back in school, and a big question that we've been getting is, should children be wearing masks in school?
Yes, so both the CDC, the American Academy of Pediatrics recommend in areas of high transmission and substantial transmission, which we are, that kids K through 12 should be wearing masks in schools. Actually, children down to age 2 can safely wear masks and should be doing so.
Okay. Is Lee Health still performing elective surgeries?
We have limited some elective surgeries that require an overnight stay, but we are still doing some elective surgeries and certainly doing any emergency surgeries.
Okay. Do any of the COVID-19 vaccines lead to infertility?
There has not been any evidence since the vaccines have been introduced that would tend to lead anyone to think that infertility is a side effect of the vaccine. I don't know if you want to
Yes, and actually there was even a study that came out a couple of months ago that looked at, I believe it was in vitro fertilization patients, and patients who had been vaccinated actually had higher successful implantation rates than patients who hadn't been vaccinated. It was a really small study, so I don't know that I would tout the vaccine as increasing the rate of successful implantation, but certainly it didn't interfere with the implantation at that point.
So we have a question, it looks like it's about the flu shot. Can you get the flu shot and a booster at the same time?
At this point, yes. We do not have any guidance yet on if you don't get them at the same time, how far we have to separate them. It is likely that there will be a recommendation if you don't get them at the same time that you would separate them by about 4 weeks. That's pretty common for most vaccines just because of immunologic response, but that recommendation hasn't come forth from the ACIP yet.
Okay. A question we just got from Facebook, do you need a doctor referral to get a child COVID tested?
So no, if you're going to a site that does pediatric testing, which some of the sites in the community may not test pediatric patients. So if you're going to one of those sites, you need to check the rules with that particular site. But basically, from our perspective at Lee Health, if your child needs tested and you've given us the authority to take care of your child, we can test you under that general authority to provide medical care.
Okay. Do we have a number of how many employees have tested positive for COVID-19 in our hospital?
I don't have that number.
Goodness, I don't have that number off the top of my head. Okay. Sorry.
When should we get vaccinated at a hospital rather than a retail pharmacy? Do we have a preference there?
The recommendations have been that if you've had a vaccine in the past and have suffered a reaction, an allergic reaction, it would make sense to do so in a hospital setting.
Okay, thank you. So we've kind of gone over this question, and I'll just ask it again because we keep receiving it. Is Lee Health keeping track of which vaccines are having the most breakthrough cases?
No, we're unfortunately not keeping track of that information. First of all, we don't necessarily know all of the breakthrough cases because many patients with breakthrough won't present to our facilities. So no, I would say we don't have a good mechanism for keeping track of that on a population basis. When individual patients are in, we do know what their vaccine status is. We can ask them, we can find it in Florida Shots and evaluate that, but we're not keeping track of specific ones.
So we have another question about pregnancy. Are there any adverse reactions to the fetus if a woman is pregnant and receiving antibody infusion?
At this point, no.
I'm not aware of any. And again, the challenge we have is we know that COVID is a serious complication for pregnant women. That's why it's recommended.
And other antibody treatments that we've done prior to COVID have been used successfully in pregnant women without untoward effects. So we wouldn't expect to see that problem. We would definitely expect that that not treating for COVID could have a worse outcome.
Question we have from Facebook: what are you doing with people that are coming in for a stroke or heart attack?
Well, our emergency departments are still fully manned and open, so anyone who has an emergency can come to our EDs and we'll get expert care. We'll be triaged appropriately and we'll get care. So it's no worry at the present time if you have an emergency, and that includes traumas, heart attacks, strokes, etc. We are here to take care of you.
If a patient does test positive for COVID-19 and they need to be hospitalized, what treatment therapies are we using for them?
So there are a variety of treatments, and it depends on how sick you are. Probably our workhorse medication, the one that we use most often, is called remdesivir. It's an antiviral medication that has direct effect on the replicating ability of the virus. So that's one medication that, depending on the severity of your illness, you may qualify for. Some patients, also depending upon the severity of their illness, may qualify for steroids. Those are given to decrease the inflammation in the lungs. They don't have a direct effect on the virus, but they may reduce the response that your lungs have to the virus. There are also other anti-inflammatory medications that can be given. Again, depending on severity of disease, there's a little bit of an algorithm you have to follow to know whether or not those medications could be beneficial. If you're not hospitalized, so you come in, we diagnose you, but you're not bad enough to need to be hospitalized, then monoclonal antibody is probably the best thing for us to consider to treat you with.
So those, that's an excellent review of the pharmaceutical treatments. Obviously, there's supportive care. Oxygen plays a big role, as we've talked about before. Positioning, there are other things that we do while you're in the hospital to treat COVID.
Okay, thank you. Question about testing. Are the COVID tests that you can take at home, are they reliable?
So it very much depends upon the COVID test, and it depends upon how you collect it. So I've always said, from a laboratory perspective, it's garbage in, garbage out. You can have the best test ever, and if you don't collect it the right way and process it the right way, then it doesn't do you any good. So unfortunately, testing in the home sometimes can be less reliable for a variety of reasons. Sometimes it's because the test itself isn't as good. Sometimes it's because the way the test got to you, maybe the temperature control wasn't as good, or maybe it was stored somewhere where it shouldn't have been. So that can make it a little more difficult. And then the actual process of collecting the specimen and running the test, you can also make some errors there. So in general, those tests can be helpful. If they're negative and you look like you have COVID, I wouldn't trust them over a hospital or a clinic-based test.
So we've had some theories come in about why our numbers here in Florida could be so high. And, one of the theories is that it's very hot here and people are spending a lot of time indoors right now. If that is the case, if we give that theory some ground, do we suspect that our numbers might go back down once the temperatures get a little cooler outside? Is there any ground that we can give to this theory?
So I guess what I would say is we don't know that there's any seasonality to COVID, unfortunately. And in particular, this Delta variant, at least in our eyes, it doesn't seem to be something that external forces are acting upon. It seems to be behaviorally driven. It's people interacting with other people. So if our temperatures get cooler, I wouldn't expect that our rates of COVID would go down drastically unless our behavior changes significantly. How significantly would it have to change? Maybe a cold snap would do that. I really think it's more about wearing a mask, keeping yourself distanced. I don't think the weather has that much to do with it. I could be wrong, but we haven't seen that yet. Okay.
And we've got quite a while before it cools down here.
We do.
And I hate to think that we're going to continue to increase at this rate until October.
Yes, absolutely. What is causing vaccinated people to be hospitalized after getting COVID if they're vaccinated?
Yeah.
And maybe we should explain, do we have a number of how many patients are in our hospital with COVID that have been vaccinated? Are we keeping track of that as well?
Yeah, it looks like it's less than 10% of the hospitalized patients are fully vaccinated. And there's a lot of different factors that you would look at. One would be the underlying health condition. So if you have a lot of comorbidities, you might be more likely to get hospitalized. But we know that even after full vaccination, the virus can still be present in your nose and your mouth. And so as a result, it can still cause infection. We also know that if a vaccine is 95% effective in preventing serious illness and death, that it's 5% ineffective. And there is a certain number of patients, when you apply that percentage to a large number, like in Lee County of 300 or so thousand that have been immunized, you're going to have some patients that are going to be sick.
Yes, and in general, the patients who are vaccinated are being admitted with the same symptoms as the unvaccinated. Their disease doesn't look that much different, though most of them will have milder cases than the vaccinated will. But again, it goes back to those same kinds of symptoms. If you're having trouble breathing and you can't be supported at home, that's why we'd have to keep you here in the hospital.
So one of our viewers asked, I only received the first shot of the vaccine and the time has run out. Can I still get a shot after a few months?
Absolutely. We want you to go get that second vaccine. Ideally, it's given either 21 days for Pfizer or 28 days for Moderna after your first dose. But if you are months out from your first dose, you can still get benefit from your second dose, and so you should go ahead and proceed with that.
That's good to know. Okay. So a question we have from Facebook, are nurses who are caring for COVID positive patients also caring for non-COVID patients in the same shift, or are we keeping COVID patients, non-COVID patients separated in our hospital?
So
I don't know. I mean, that probably changes from day to day too. I know we've made an effort to try to cohort COVID patients as much as we can, but I don't know if that's universally done in the hospital.
yeah, what I would say though is we do have very strict protocols. So if a patient has COVID, the type of protective equipment that a nurse or any healthcare provider has to wear in order to go into that room, you have to wear a gown, you have to wear gloves, you have to wear eye protection, you have to wear a special kind of mask. Once you go out of that room, the things externally that are going to touch other patients, your gown, your gloves, wash your hands, all of those things have to be changed before you would go take care of another patient, whether they had COVID or not. So we're providing that barrier, those precautions when we do have patients on isolation for things like COVID.
Okay, thank you. How are we making it easier for transplant or cancer survivors to receive the booster?
Well, the booster shot is available for those patients who are immunosuppressed right here at Gulf Coast Medical Center on Tuesdays and Fridays from 7:30 to 3:30. So you can make an appointment online at our website, or you can simply walk in and get the vaccine.
So we have a question here. How much more effective is masking and vaccinated as opposed to the vaccine alone? Sounds like another masking question.
Yeah, so I think it depends on the scenario. If you're vaccinated and you are not infected, meaning that you don't have any virus in your nose, the mask probably doesn't help you that much until you come close to someone who has it, who's unmasked. In that scenario, you could get asymptomatic infection or you could get mild infection, and you wouldn't have the protection of the mask. The vaccine's going to keep you probably from being in the hospital or being severely ill, but it may not prevent you from spreading it to someone else in your family. So really the difference is risking that exposure and having mild to moderate disease and then potentially infecting someone else.
Thank you. Can you talk about the risks of vaccinating a child and the endocarditis complications?
Sure. So the mRNA vaccines, Moderna and Pfizer, after we started vaccinating younger people, were associated with actually myocarditis and pericarditis, not endocarditis. And that's just a difference in the anatomy of the heart. There was an association, particularly in males, particularly in young males, that they had an increased risk of mild symptoms of myocarditis and pericarditis after mRNA vaccine. So that is real. It was definitely an association. Why it happens probably has to do with the inflammatory cascade that's set off when your body responds to that vaccine. But we don't know precisely which molecules do that. We do know that if you get natural COVID infection and you're not vaccinated, so just natural COVID infection, you have a high likelihood for that same population to have myocarditis or pericarditis. And those patients are much sicker than the ones who get it from the vaccine. So we know that it's something to do with inflammation. We know that it's something to do with the body's response to something in the virus, probably to something in that spike protein that the mRNA makes. We don't know exactly why. We do know that if you get it from the vaccine, the vast majority of those patients are mildly symptomatic. If we weren't looking for it, we may not even find that they have myocarditis or pericarditis, and they reverse their disease quickly, frequently without much intervention, which is not the case with natural infection.
Dr. Stolva, can you comment on how common the myocarditis is post-vaccine?
Yeah, so
rare?
It's actually pretty rare. We've seen a couple of cases of it here associated with post-vaccine here in our area, in our region. But we've seen far more with patients who actually have natural infection. So I would say it is rare, but it is something that we've seen a couple of cases of. All of the patients that we've seen who have had vaccine-associated myocarditis and pericarditis have resolved their symptoms and done just fine.
Thank you. Now that Pfizer's been approved, do you think it will be added to the immunization for schools?
You know, I think that eventually we may see that if COVID becomes an endemic infection. So typically for schools, you look at infections that are going to become endemic, that are highly transmissible in schools, because you only really catch that each year at the beginning of school. Everybody has to come in, they have to show their proof of immunization. So doing it once a year is not going to really be helpful in a pandemic situation where you have this ongoing transmission. But if we see COVID become something like influenza, for instance, you may very well see that as highly transmissible as it is. But I think it's a little too soon to make those kinds of judgments.
Okay, thank you. We are receiving a lot of questions from our viewers today on Facebook. So thank you guys so much for sending in all of your questions. We're going to try to get to as many as we can. We did have a question to ask about using ventilators as treatment in our hospitals. Can you comment on that?
Sure.
Okay. So we try pre-COVID and during COVID. You try as a doctor to never have to put someone on a ventilator. You know, the body was designed to do the job that for the lungs to do their own work and not for us to do that artificially. And ventilators do the artificial work of the lungs. Anytime we as physicians make an effort to interfere in the way the body is supposed to work, there's a trade-off. There's a risk-benefit analysis. So we don't typically use ventilators for therapy unless it's the last thing that we can do, the last thing that we can offer. So if we have a patient who cannot oxygenate themselves, they can't get enough oxygen to their brain, if they can't exchange the gases in their lungs the way they're supposed to, and we can't, turn them over. Dr. Antonucci talked about positioning. If we can't position you in a way to make your lungs work better, if we can't provide oxygen in another way to make your lungs work better, the ventilator is our last effort. So do we use it for therapy? Yes, we do, but it is a last-ditch effort because we know the trade-off, and the trade-off is that the ventilator can never be as good as a healthy set of lungs.
And I think it really speaks to the evolution of treatment in COVID. When COVID first came and we knew nothing about the virus, we were treating it as we did many other respiratory conditions. And what we recognized is that putting people on ventilators early in the process was actually not doing what we wanted it to do. And literature began coming out that you're better off not using ventilators early in the course, but only, as Dr. Stoll said, as a last resort, and that's what we're doing now. But unfortunately, as I mentioned earlier, we have 84 patients on ventilators with COVID. That's a significantly high number and a very worrisome number.
Can you talk about at-home remedies for patients who are sick and maybe they have tested positive for COVID, but they are showing symptoms?
Yeah, so I think there aren't a lot of pharmaceutical at-home remedies that can be recommended at this point. There are things that you can do for your health to try to keep yourself from getting sicker. So things like mobilizing your body. You're not going to feel like wanting to walk around. You're not going to feel like wanting to reposition yourself. But if you sit still for too long, you'll be more likely to develop blood clots. You'll be less likely to take deep breaths and to use those parts of your lungs that we want to keep active. Other things that you can do, you can try sleeping on your stomach. We have recommendations that we give to some of our patients who come to the emergency departments about what we call self-proning, which means putting yourself on your stomach to rest so that your lungs can actually inflate better. So there are things like that that you can do, keeping yourself well hydrated, keeping an eye on your own health and knowing when to seek medical care. If you're having a hard time breathing, if you're having a hard time keeping fluids down, we definitely want you to seek medical care. But those general things to try to improve your health are important things to do until you get to the point where you need us.
Thank you. Talk about the impact of COVID on our healthcare workers and how the community can help to support them.
Well, this has been a tremendous strain on our healthcare workers, and we are seeing that strain both physically and emotionally. The volume of patients we're seeing with COVID, as I said, is unprecedented. The nature of the patients we're seeing, younger and younger patients, otherwise healthy patients, makes it very, very difficult for our staff members. We go into healthcare because we want to help people and we want people to get better, and we expect that when they leave our hospital, they leave in better condition than when they came. And when that doesn't happen, it really affects us, and we take it personally. And so it's been very, very difficult. One of our ICU physicians was here earlier speaking about how difficult it is to have to put a 23-year-old, otherwise healthy person on a ventilator because they have COVID. And especially when you recognize the fact that many of these cases are preventable. It really takes its toll. Through our foundation, through the Lee Health Foundation, we are accepting any type of donations for our staff, donations of food, etc. And this community has been incredibly generous. Hundreds and hundreds of businesses, people have made masks, they've donated food, restaurants have donated food to help support our staff. It's been truly remarkable and heartwarming to see what this community has done for our staff, and I know they deeply appreciate it.
Thank you, Dr. Antonucci. I want to thank you both for your time today. We are out of time, and thank you to everyone who tuned in today. We have received a lot of questions. There were a lot of questions we didn't get to today, but I think we put a lot of really good information out there, so I thank you both for that. We do encourage you, if you have additional questions, you can always chime in on our Facebook page, and we encourage you to go to our website, leehealth.org. There's a lot of really good information there and a lot of resources that can hopefully help to answer those questions too. So we want to thank you for joining us and stay safe.
Thank you, Lindsay. Appreciate it.